Hi, Dr. Morse. Hi,
Hi,
thank
Matt.
you. Thank
How
you
are
so
you?
I'm okay. Yeah, thank you so much for meeting with me today. I'm super excited to be having this conversation with you.
Me too. I've been looking forward to it.
I also want to say I appreciate that we're able to meet remotely as a COVID precaution, particularly as COVID numbers are ticking up as they usually do in the winter. So,
Absolutely. Absolutely. No, it's a time when we're seeing numbers go upwards in the 30 to 50% range for COVID, RSV, and flu. So this is definitely the right precaution.
yeah, thank you. And before we begin today, I want to take a moment to explain why you and I are having this conversation. You currently serve as the head of the largest health department in the country in New York City. And as an actor and an activist, I have become very passionate about public health. I've been dealing with long COVID for more than a year and a half now. And it's important for me to be able to communicate the risks to people as much as possible, and particularly about the sort of cumulative risks of getting COVID and its relation to long COVID. So that's really the purpose of our conversation today. And to start out, I have a few questions about your leadership and about how the New York City Department of Health approached COVID both at the beginning of the pandemic and now.
Well, thank you again, Matt, just for your courage and your attention to this issue and your organizing and activism. I think our whole purpose in public health really is to serve the needs of the public and protect their health. And we can't do that well unless we have folks like you, guiding us and really shaping a lot of the conversations that need to be had. So I just really appreciate the opportunity. And I will say it has been an honor, and also, and not an easy time in public health to step up and serve as acting health commissioner. One thing I do have going for me, however, is that I started here at the health department almost 4 years ago. I had the honor of becoming the first ever chief medical officer. And the time that I started in, February 2021, was when the vaccination campaign for COVID was just getting started. We had suffered through 2020 at that point, which was a very challenging time. It was both a time, of course, of just raised awareness and consciousness of the unfair impacts of COVID on different communities, particularly historically marginalized communities. And it was also a time after the murder of George Floyd where there was so much attention to social justice and racial justice. And so I was excited to start here because this is an agency that has an incredible history and reputation for staying and remaining committed to health equity and racial justice. And it was also a time when there was some hopefulness because the vaccine was available. And our challenge was no longer let's kind of sit and wait. It was we now have this intervention that we expect to be life-saving. And how can we make sure that everyone who wants this vaccine gets access to it, no matter how much they're paid, no matter if they're insured, no matter what race or ethnicity or neighborhood they live in. And that was a very important and exciting time to be here because we're one of the biggest cities in the country and in the world. We're one of the most global cities in the country and in the world. We have over 130 languages spoken regularly. So to join this team of public health heroes in a time when we actually had interventions that we knew were going to make a difference was extremely exciting and also extremely challenging with very long hours and lots of other, big landmines, quite frankly, when it comes to things like misinformation, inequity, and lack of access to healthcare and health insurance, and so many other things.
Yeah, I appreciate all that, and also want to say I personally deeply appreciate your lens and your work around health disparities in terms of marginalized communities. It's so important, and I'd be interested to hear a bit about sort of the major turning points as scientists were learning more about the virus. What did that look like from inside the health department?
Yes, thank you for that question because it was a very, very challenging time. We were working with not enough information, particularly at the beginning of what became the pandemic. In fact, it was a time when there was a lot of conflicting information coming from different institutions and bodies. It was a time when it was hard to even know how the virus was transmitted. So some of those most important moments early in the pandemic for us as public health professionals and as public health workers was really nailing down how transmission was happening.
Yeah.
And that took some time. Being able to actually test for the virus itself was a big milestone. Knowing what protective measures would actually work. Realizing that it was going to be, well-fitted masks, realizing that it was going to be, really not being in crowded spaces and things like that. And then, of course, the time that it took to develop and make available the vaccine. That was a huge turning point in the early days of the pandemic that for us just really changed what we were able to do in terms of getting reliable tools that were protective for the health of the public into the hands of the public. And then the final thing I'll say, of course, is that just treatment for COVID. It was very unclear in the early days what treatments might have worked, what treatments were going to prevent hospitalization, what treatments were going to be life-saving, and that took some time to develop. So there were many important milestones in those early days of the pandemic, and we found our way through them, but we were having to develop a lot of things just real time because it was so unprecedented.
This time was so traumatizing and difficult for so many people. And understandably, people are so eager to move on from wanting to think about COVID, right? So in this time, what do you think is the responsibility of public health officials for offering public guidance about balancing personal and community risk management?
It is such an important question, and I will say that one of the beauties of public health and one of the most important tools that we have is communications with the public. And what we have a responsibility to do is to ensure that the public, and here in New York City, of course, New Yorkers, have reliable and accurate information in the ways that they want it, in the language that they want it, in the places that they want it, so that they can best protect themselves and their community in a way, again, that's grounded in science and that's also grounded in an understanding of equity. I think that we here in the New York City Health Department feel particularly strongly about the equity piece, right? If we can predict which communities are going to have unfair impacts from infections, from pandemics, from lots of different things, that means that we have a responsibility to prioritize those communities and make sure that the information they have, that the access to life-saving interventions that they have is prioritized so that we don't see that same pattern. And here in New York City, that pattern is often in communities that had been historically redlined, which was a federal policy that essentially did not allow for home ownership for Black and brown communities in certain neighborhoods. Those communities are the ones to this day that have experienced disinvestment, that have experienced the impacts of structural racism, that have some of the lowest income and some of the highest burden of disease. And so we also have a responsibility to say these are communities that we know because of historical choices, because of the history of this nation in who is prioritized and who isn't, that we have to do double duty.
Yeah.
And make sure that we are clear that these are the communities we owe prioritization. And that's part of our communications in public health, right? We have to make sure that we don't see the same pattern of inequity over and over again. So our responsibility 100% is to make sure that reliable information is available. And I'll say that that's going to become even more important in a time when there are going to be competing data, competing messages, and frank misinformation about what is truly protective for the health of the public. And so I see our responsibility in terms of communicating to the public accurate and reliable information to be even more important in 2025 and beyond. And I'll also just say that part of the reason that we're still so focused on measures for the public across New York City to protect themselves against COVID is because that's also what prevents long COVID. And so we feel like it's still important, of course, for us to be clear that things like getting your COVID vaccine up to date, wearing masks in crowded places, particularly if you have medical risks, those are all things that we continue to say because preventing COVID also prevents long COVID.
Thank you so much for your thoughtful answers and for your work in this area, Dr. Morse. I really appreciate it.
Thank you so much, Matt.